And I mean, that's the story of America in the 20th century, that World War II, the GI Bill, created the middle class of America, but it excluded African Americans from the burgeoning military social welfare net,
Yeah.
right? And so I was really struck by what you said about PTSD, because we had conversations earlier about how, especially since 2001, PTSD and traumatic brain injury, the signature wounds of war, have been common in discourse about veterans. But I'm curious, do you think that Black men especially are denied that benefit of a doubt when it comes to mental health? Do people look at Black men as something that is other, that doesn't get recognized as having mental health problems or PTSD or traumatic brain injury, because they're excluded from mental health care through the VA?
I think there's multifaceted answers to that question. I think one, there's historical evidence, and I believe there's been medical studies that people believe that Black folk experience pain at different levels than white folk, right? And that's not true. We are fighting the same wars, overcoming the same hurdles, oftentimes greater challenges. I also think that there is a real discount to the weight of discrimination and the scars that leaves on Black folk who've served historically and even today if they come up against it. And so that's discounted, right? And so when somebody puts in a claim and maybe they're talking about their experiences in war, but they also bring race into the equation, it kind of is dismissed, right? And so I can't answer exactly why the racial disparities exist in such a gross way as they do, persisting to exist the way that they do. But I also know that there's a lack of distrust over decades of generations of service. And so, even when it comes to mental health, it's not that Black folk don't suffer the same wounds of war, but they might have different ways of dealing with it. So documentation also becomes an issue, right? When you're in the military, your white counterparts might go seek that mental health care. Whereas if you're trying to go seek it as a black soldier, man or woman, because I don't think it genuinely makes a difference, you could be seen as someone who's trying to get out of their job, who's trying to make an excuse, right? Because you're also seen as somebody who just doesn't feel pain or experience mental anguish on the same levels as your white counterparts, right? And your experiences are discounted in that way.
It's also that knowledge of how to navigate institutional structures, and
Yeah.
how to seek out help with the VA, and how to file for a petition to upgrade a discharge. But
And
you're right.
the lack of cultural competencies that often exist within the VA itself.